Before COVID-19 pandemic hit, it was projected that New Zealand will need 15,000 nurses by 2035 and that we would feel this increased demand for nurses from 2020. Obviously, COVID-19 happened, MIQ facilities were established, and they needed nursing staff for that. Nurses were also called to help on COVID-19 testing stations and vaccination centers, and still, a number of New Zealand nurses pursued job opportunities in other countries like Australia. So in this video, I thought it'll be a good idea to explore job opportunities in New Zealand in 2021. There are different employers within the healthcare system of New Zealand. If you're not familiar with that, I recommend you check out my video about finding employment in health. Otherwise, on this video, we'll talk about different job types like permanent role, fixed-term role, part-time, full-time, casual hours, and we'll also talk about FTE or full-time equivalent and which employer can sponsor for a work visa. So, grab your pen, take some notes, details up next. Notes Weekly. Before we look at some examples of job postings, if we are just meeting, kia ora, my name is Binibining Veronica. I am a Filipino Kiwi nurse living in New Zealand, and on this channel, I create videos about nursing and life in New Zealand. So if you're new here, please make sure to hit like and subscribe. Salamat po! Job vacancy number 1. They're looking for a practice nurse in Auckland, and it's really good because in their advertisement, they already have the role there, which is they're looking for a full-time nurse. Full-time meaning 40 hours a week, or other way of saying it, it's 1.0 FTE, which means you're working 10 shifts a fortnight. A fortnight is every 2 weeks, which that's how often you get paid here in New Zealand. Otherwise, you can also be paid weekly. I think there's a nurse I've met before in an aged care facility and they get paid weekly. But overall, other nurses most of the time get paid every fortnight. So, going back to this advertisement, they also have the salary posted there. It says $25 to $35 per hour, depending on your years of experience. And then the next part of the advertisement, there is some information about the employer, which I highly recommend that you read, especially if you're applying. And there's also a brief description about the role. So it says here, they're looking for an applicant who has a strong commitment to providing patient-focused care, has excellent communication and interpersonal skills, a team player with strong organizational and time management skills. You will be adaptable, open to change, and able to relate well to people from a variety of backgrounds and cultures. We are seeking someone motivated to deliver a high level of care, ensuring the smooth running of clinic operations. This is a fast-paced, busy role. The ability to multitask is crucial, as is the ability to maintain professionalism and confidentiality. Professional development is supported and encouraged, and you will be working collaboratively with general and nurse practitioners, administrators, practice managers, directors, pharmacy, laboratory, and our PHO provider to ensure our patient needs are met. And if you don't have an idea about practice nurses, they work in GP practices, so it's a private organization based in the community. I've actually done a lot of interviews with a practice manager in New Zealand, and we talked more about GP practices then. So yeah, check out that video if you want to know more about practice nurses. Otherwise, for this job vacancy, requirements: a current New Zealand practicing certificate is essential, current vaccination smear taker, CPR certificate, excellent communication and interpersonal skills, confident, friendly, and approachable, enthusiastic, innovative, adaptable, and not afraid of change, and prior experience working in a primary care medical clinic. Hours of work, Monday to Friday, 7:30 to 5:30 p.m. And more importantly, applicants for this position should have New Zealand residency or a valid New Zealand work visa. So I've specifically used this job vacancy as an example because, as you can see here, it's clearly written that they're not sponsoring preferred applicants who already have the right to work in New Zealand permanently or at least temporarily. So yeah, anyone watching the video who's a CAP student or an overseas nurse, I would discourage you applying in this role because they've already stated that they're wanting someone with the right visa status, so it would be a waste of your time to still apply for this role, if you know what I mean. Job vacancy number 2 is a surgical ward in the North Island. So this is a public hospital. So this is offered for a full-time FTE. I think you can negotiate the hours because they're actually advertising for 2.2 FTE, which means they're looking for more than one person. So you can either work full-time or part-time. And so there's a bit of a brief again about the particular unit. So the purpose of this service is to care for surgical patients, pre and post procedures in both the acute and elective settings, along with ENT, vascular and general surgical patients. These permanent positions have a requirement to work rostered shifts, including morning, afternoon, and night shifts. And ideally, the successful applicant will have experience working as a nurse in an acute surgical setting with vascular and ENT nursing experience preferred, but not necessary. Now, I actually had to go through the actual job posting in that particular DHB just so I can see the position description. If you've seen an advertisement in a different website, like just a general website, and it's for a DHB application, I suggest you go through the main DHB website so you can see the attachment for the position description. It will also help you once you got shortlisted for the job interview, so you'll know more about the position that you are applying for. And like I said here at the bottom, interested, please state in your cover letter how many hours you wish to be considered for. They didn't write in the job advertisement how much the salary is for this particular position, but if you want to know, in New Zealand, if you are working in the public hospital, your salary is the same. It doesn't matter where you're working, if you're working in Auckland, Tauranga, Christchurch, or Wellington. You are covered by the same collective agreement, therefore the salary is the same regardless of where you work. It will only vary on your years of experience. And I have already created a video about salary for nurses working in a public hospital, so just click the link above if you want to watch that. Otherwise, what else can I tell you? Oh, and for overseas nurses, most of the time, in my experience anyway, public hospitals do sponsor for work visa or support your application anyway, so yeah. The only thing that you have to check with NZ Immigration is if there's a minimum hours, because I can't remember if it was 0.8 FTE to apply for a work visa. So I'll write the link below for the New Zealand Immigration website so you can double check that. What else can I tell you? If you're still doing your competence assessment program, just know that there are some DHBs which are really strict. They prefer that you finish your competency assessment program before you apply. However, there are others who's willing to look at your CV, your cover letter, and interview you as well. So you can try your luck and just make sure that you write in your cover letter when your end date or expected graduation date is so that they can kind of estimate when you will be available to start your new job. Job vacancy number 3 is in the emergency department of a hospital in South Island, and this one I specifically used this example because the job advertisement is for a fixed term role, which means there is an end date to that contract. They're actually advertising 2 positions. The first position will end February 14, 2022. Happy Valentine's Day! And the other position will be ending November 30, 2021, and both positions are offered for a 0.7 FTE, which is 7 shifts a fortnight or 56 hours. And yeah, so like I said a while ago, just double check with NZ Immigration because I'm not sure what the work visa requirements are. If you should have a permanent role in order for you to get work visa, I'm not too sure about that. But yeah, that is what it means by a fixed term role. So I think perhaps, someone's on maternity leave, that's why they have this fixed term vacancy. And if you are interested, the requirement for this position, who is an appropriate applicant, you will be a New Zealand registered nurse with current practicing certificate and post-registration nursing experience in ED or acute care. You will also be a team player who enjoys keeping up to date with clinical practice with excellent organizational and time management skills and a commitment to quality. O, diba? And when I say practicing certificate, by the way, it's just like our PRC certificate as well. The one that was printed in A4 size paper. Oh, in the Philippines, you have 2 sizes of paper, short bond paper and long bond paper. But in New Zealand, the standard size is an A4 paper. So, just letting you know, wala lang. Para aware lang kayo. Job vacancy number 4 is for a rest home in Wellington. And they are specifically looking for a nurse on a permanent night shift. And this one is for a part-time role. They didn't exactly say for how many FTE, but I'm just including this in my examples, again, just to highlight that in their job description, they specifically said applicants for this position should have New Zealand residency or a valid New Zealand work visa. So again, for our overseas nurses who still doesn't have a work visa or doesn't have a residency, I would discourage you from applying in this position. So this position would be good if you are already working in New Zealand as an aged care nurse and you just want a bit of a change. Maybe you want to move to Wellington, maybe you want a permanent night shift, then by all means, I think this will be good for you, because they're specifically requesting for someone with minimum 2 years nursing experience. So yeah, good to know. Job vacancy number 5, and this one is from a bigger aged care facility in Auckland. And if you've seen my last video about aged care facility, I've also included a video about the salary of nurses working in aged care facility, and you can watch it in the link above. So yeah, just check that out. So for this particular advertisement, they specifically wrote here they're offering full-time employment. So again, that's 1.0 FTE. They also stated their requirements and their rates, which they said is they are currently matching the DHB rates plus 50 cents on the hour. However, for overtime pay, they're only paying time and a half. And the good thing about this bigger aged care facility, it says here, we welcome overseas applicants for this role who are currently working through relocation or looking to move to New Zealand. So yeah, because they are a bigger aged care facility, they can sponsor overseas applicants. So I guess that's just good to know for you, right? So those are my 5 job vacancy examples. Like I said, for overseas nurses, you really have to look at the job descriptions, because not all employers can support your work visa applications. Usually, it's the public hospitals, the DHB, some private hospitals, and bigger aged care facilities. Now, if you want to check out for more vacancies, then the websites to go to are 𝐍𝐶.co.nz, trademe.co.nz, and kiwihealthjobs.com. Obviously, you can also go directly to the employer's website. So just to give you an idea of the number of vacancies that we have in New Zealand at the moment, if we check 𝐶.co.nz, there are 725 vacancies, and the breakdown are as follows. A&E Critical Care and ICU, 18 vacancies. Aged Care, 293. Community Maternal and Child Care, 136. Educators and Facilitators, 14. General Medicine and Surgical, 122. High Acuity, 6. Management, 42. Midwifery, Neonatal, SCN and NICU, 13. Pediatric and PICU, 3. Psych, Forensic, Correctional Health, 44. Theater and Recovery, 34. So yeah, these are all over New Zealand, and when you are reviewing the job posting, sometimes you'll see that there may be multiple advertisements for the same role in the same website, or employers may also advertise in other websites like trademe.co.nz. Speaking of which, there are 777 vacancies in trademe.co.nz, and the breakdown are as follows. Community and Primary Care, 252. Critical Care and Emergency, 35. Medical, 55. Mental Health, 69. Pediatrics, 9. Surgical, 41. Theater and Recovery, 40. Women's Health, 64. Others, 212. And finally, there are 463 job vacancies at kiwihealthjobs.com, and these are mostly vacancies in district health boards or public hospitals. Alternatively, you can also check out my public Facebook page at Binibining Veronica, Pinoy Nurse in New Zealand. Sometimes I post job vacancies there, so yeah, feel free to check that out. I also create free templates and checklists for NZRN applicants, and you can grab all my worksheets on our Facebook group Notes by Veronica. It is my sincerest hope that by creating these videos, I'll be able to help overseas nurses complete their NZRN registration, find a job, and get settled in New Zealand. As always, I wish you all the best with your journey, and I hope you will be blessed. I'll see you soon. Bye! If you reached the end of this video without skipping, then put down a wink emoji in the comment section below so that I know who you people are. Thank you for supporting my channel. Bye!